so I just finished my first medical school exam week. Here's how it went. What's going on, everyone? Welcome back to my channel and thank you for clicking on this video. For those of you who may be new to the channel, my name is Terence and I'm a first year medical student. If you're new, make sure you subscribe and like the video if you enjoy these videos. I'll be putting out weekly videos just like this every single week, so make sure you subscribe and come along for the journey. I just finished up my first week of exams here in medical school. The way my school does it and the way that many medical schools do it is you essentially have multiple weeks of content. So for me, it was 5 weeks of content. Then we have an exam week. Essentially what the exam week is you have a breakdown of clinical skills exams on one day, an anatomy practical on another day, and then the final day is your written exam. So for us, we had a clinical skills exam on vital signs. We introduced ourselves to the patient or a virtual patient. Then we had a simulated arm, which we did blood pressure and heart rate on. And then we reported back our findings to the virtual patient. That was pretty good. And then the next thing we had was anatomy practical, which was 30 questions of identifying back, shoulder, nerves, anatomy, histology, based on all our 5 weeks of content. And then we had a 120 question written exam that I just finished taking. Those are on every single thing, everything that we learned from every learning objective, from clinical skills, case-based learning, lectures, anything and everything in between. We had our 120 question all-encompassing written exam. So how did it go for me? I first want to say that I kind of like so far how the curriculum is structured and how everything has been structured. I like having the weeks of content that kind of accumulate on top of one another, and then you have your exam week. The benefit I feel of the exam week is I've been able to just use this week so far. You know, you have your examinations, you have your clinical skills, but they're not taking up that much time in your day, and you're able to use most of your day to study and kind of reflect. A lot of this should be review, and we were kind of told, you know, this should be a review period for you. You shouldn't be really learning anything new during this week of the exam. And for me, the week of the exam was exactly that. Just we're doing a lot of review. Basically, my study strategy thus far has been to pretty much grind during the week. We have quizzes at the end of every single week, so it kind of uses as a checkpoint for us to understand, all right, this is where I kind of fall as far as my knowledge of the curriculum, things I might want to work on and improve on. So I've been kind of using those quizzes to help guide me going forward, and then every single week I'll just use that as like a snowball effect to eventually you get to the exam where you've reviewed everything and you've seen everything at least once, and now it's just time to kind of finalize it and get those reviews in. All right, so now let's talk about the fun stuff. How did the exams go? For me, I think that they went well. For us, we just have to do a pass. So basically it's P equals MD. As long as you pass all the exams, you can move forward and continue on to the following blocks and the following semesters. So for me, I think that they went well. I had my clinical skills exam and my standardized patient seemed to give me positive feedback as far as everything that I did. My anatomy practical, I think, was fair and it went well for me. I studied really hard and I probably studied more than I needed to. The anatomy practical, because we can't be in person, is actually multiple choice, so it makes it a little bit easier for us to kind of narrow down certain answer choices if you're kind of uncertain. And then for the 120 question written exam, it's all multiple choice again. It's 3 hours long. I think I took about 2.5 hours, or 2 hours, 15 minutes, 2.5 hours. And overall, I think it went well. Till this day, I've taken hundreds of exams and I still find it hard to determine kind of where you're gonna fall. I felt confident coming out of the exam, but there are always those questions that kind of trip you up and kind of stay in the back of your mind and make you feel like maybe you got worse than you actually did, or maybe you did better than you actually did. So it's hard to say, but I think overall I'm confident that I passed, and I'm happy and excited to move on to block 2 and take on that next challenge. So what are my plans for block 2? So right now, my strategies have been pretty good. With block 2, I definitely want to get involved in more extracurricular activities, maybe some research as well, and start doing some additional things on top of my curriculum. Medical school, they tell you, you know, focus on your grades first. Of course, that's important, but for me, right now, I want to try to get as efficient as possible with my grades and with my lectures and with everything that I have to do that medical school requires, so that I could free up some time so I could do research and do other additional projects and get those things under my belt as well early on. So those are kind of my thoughts going into block 2. What should I do to improve that? That's kind of what I'm doing this weekend, kind of analyzing the stuff that I've been doing and the strategies I've been taking, how I can make it more efficient and how I can improve it going forward. I kind of know now what an exam looks like, an exam week looks like. So now I can kind of say, okay, maybe I didn't need to focus on this so much. Maybe I should have put more effort into that, and kind of be more efficient. I think everybody right now, and just everybody that I'm talking to, they're kind of just learning as they're going along. Same for me. You're just trying to learn how to be more efficient and as efficient as possible so that you can be successful and maximize your study time as best as possible, so you're not studying 12 hours a day every single day and burning out. So those are my plans going forward. I want to thank you guys for tuning into this video. I think the exam week went well, and this is just really my reflection on how everything went, and kind of let you guys know what my exam weeks kind of look like. If you have any questions about any specific things or any specific study strategies, I'm looking forward to making future videos once I kind of get my study strategies and everything quote unquote perfected and improved. But if you have any questions about what I'm doing now, or any other advice that you may need or may want from me, feel free to leave it in the comment section below. Make sure you're subscribed if you are new, and like the video if you enjoy these type of videos. I'll be putting out weekly videos just like this every single week, so make sure you come along for the journey. Thank you again for watching, and let's get it.